Hello everyone, drberkkkaratas. When patients who want to enlarge their penis come to me, I ask them some questions. You can analyze your situation by asking yourself the questions I ask and answering them. The business of penis enlargement continues on. It has existed since the dawn of humanity because men, even if their penis is large, always want it to be bigger. It has existed since the dawn of humanity because men want their penis to be bigger even if it is already large. This is a bit cultural, indicative, etc. This is a social situation. There is a perception, there is a prejudice. Women like a big penis, they prefer it to be thick, etc. Women say that a thicker penis, bigger penises, are important initially. A woman can be quite comfortable and happy with an average sized penis. It's important early on. A woman can be quite comfortable and happy with an average sized penis. It's not something that will come to an end. Search penis enlargement shows 801,000 results in Turkey. But in the end, it's not something that will come to an end. If you search for penis enlargement on Google, you'll find 801,000 results in Turkey. I received this data yesterday. If you search for penis enlargement, in English, you'll find almost 44 million results. So as you can see, it's an ongoing active topic. What's important here is to be able to do this without harming yourself with anything you have in your hands, without losing your own sexuality. To be able to do this without losing your own sexuality. So let's ask some questions. What are these questions? Let's ask these one by one. We'll say it here anyway. Why are we asking these questions? More precisely, why am I asking these questions to the people who come in? There is something called penis dysmorphophobia. Actually, this is body dysmorphophobia. The person not loving a part of their body or a specific area or their entire body. Feeling inadequate about it, DSM. That is, there is something that defines psychiatric disorders and psychological disorders in America. There is something, this is used all over the world. The new form that is in the DSM-5, penis dysmorphophobia, falls under obsessive compulsive disorders. So this can actually be a psychological or psychiatric diagnosis. It's very important to distinguish this well, because if that's the case, then no matter what you do, you can't make the condition happy. So even if you increase it from 16 centimeters to 30 centimeters, you won't be able to make them happy, because their issue is different. What does obsession mean? The person's thoughts, ideas, and impulses that they can't get out of their mind. It continues to develop contrary to what the person wants. The arrival of these, even if a person knows that this is illogical, they can't hold themselves back from it and become stressed. This is penis dysmorphophobia. And it's definitely important to distinguish this. It's essential to ask patients questions. Now, the first question I ask when the patient comes in is, I want to enlarge my penis. Okay, what is your penis size? Have you measured it before or not? If a person says, I haven't measured my penis, but I think it's small, then right away, there's a question mark in my mind. How can you know if something you've never measured is small or big, given that I don't have the chance to see 15, 20 of them every day like I do? So how do you know if something you've never measured is small or big? Since I don't have the chance to see 15, 20 of them every day like I do, so you can't understand this just by looking at it. So have they measured it or not? Or have you measured it or not? That's important. How do we measure it? Very simple. I explained it before. By the way, don't try to measure the penis when it's erect. That's not correct. It can be measured medically. Perfect hardness is achieved. So it can be measured, but when you start measuring hardness related to pleasure, the level of hardness may decrease. Or even if you lose 10% of your hardness that day, it will set you back by 1 to 2 centimeters. So generally, you pull it with one hand, measure length from pubic bone, circumference from, you can press it lightly without going too far to get an average number from there. And then you measure the circumference from the middle part. So what happens is that the average worldwide is around 13 centimeters for the length of the penis and about 8 centimeters when it's not erect. If your penis is around 8 centimeters in the middle when it's not erect, then you might have an average size. We consider the medical range to be between 9 and 16 centimeters. Anything below 9 is referred to as a micropenis. There, some endocrine or other hormonal studies may need to be conducted. It's referred to as a micropenis. There may be a need to conduct some endocrine or other hormonal studies there. Now, I use this a lot, and I really love doing it because I love this question. The question of what you want is very important. I mean, is it thickness, length, or both? People who come here already know their situation, so they either say length, thickness, or both. According to what is he saying? According to what I'm going to explain shortly, if a person has a penis size of 16 x 10 centimeters or 13 x 8 meters and still wants to increase it, whether it's thickness or length, there's a question. Because here, the length to width ratio is normal, above average or average. Here, as I said before, they might have never measured it, or you're measuring it and that's what you're getting. Because here, the length to width ratio is normal, above average, or at least average. Here, as I mentioned earlier, they might have never measured it, or you're measuring it and that's what you're getting. This raises a question mark. So it raises a question mark in terms of whether I should do nothing, but sometimes the illness comes in such a beautiful way that most of my illness is like that. They are a bit informed, thanks to them. Of course, they are watching our videos and so on. He says, Doctor, 16 centimeters is good, the length is good, it's already above average, but the thickness is a bit low, it should actually be around 10, 11. He says, that's right, I want thickness. Or he says, yes, the thickness is good, but the length is a bit short. I want to increase the length. Or he says, Doctor, okay, the length to width ratio isn't bad, but it's 11 to 7 and I'm below average. I want both lengthening and thickening. This is quite important, so you need to know what you want based on your situation. If I say I want both, whichever it is, then there's a bit of a problem. The issue of function is important. So sometimes I say, we measure the penis size and it comes out normal. Have you ever had sex? No. Did you use it? No. I actually compare this to something when giving an example, like there's a Ferrari parked down there, so you never use it. Then you say, I'm going to do this and that to the Ferrari. I'm going to change the bumper. Let's use it first. And let's see, when you start the car, does the ignition work? Does the engine start? I always say, if a person has sexual dysfunctions like erectile dysfunction, premature ejaculation, or lack of sexual desire, and there are issues like diseases or psychological factors, then yes. You can't solve these issues with penis enlargement or thickening. You don't mess with the bodywork. When the engine is broken, if you have a problem with premature ejaculation, you need to solve that first. It's really silly to try to mask the problem of premature ejaculation by enlarging the penis. So it went from 13 centimeters to 15 centimeters. Again, you ejaculate in 10 seconds. It doesn't make any sense. That's why I ask all my patients, ask yourself as well, whether you have a sexual dysfunction or not. If there is one, it should be solved first. Because studies have shown that there is sexual dysfunction, and if that is resolved, patients no longer want to enlarge their penis. This is quite important. Yes, the question of why I want to enlarge it, it's a very philosophical question. That's a good question. So far, I've received a lot of answers, and there are many more we can get, but I've put the most common answers here. I think it's small. So if a person hasn't measured, and you're saying it's normal based on your measurement, but as I mentioned earlier, if they still think it's small, honestly, I don't do anything for those people, whether it's surgical or non-surgical related to the penis, because there's no chance of them being happy. At that point, the focus on the penis is heading towards obsessive compulsive disorder, because there's no chance of them being happy. At that point, the focus on the penis is heading towards obsessive compulsive disorder. There, I directly say it during a session with a therapist. There's a benefit. I'm saying you have an opinion, because no matter what I do, I'm saying you won't be happy. My favorite answer is this: if I have the opportunity, why not? He says, Doctor, what would happen if it were a little bigger? So what will I lose? There are no side effects at all. There are no complications. I won't have erectile dysfunction. Nothing will change in my life. I will use the device no matter what, or I will have a small surgery. After that, I will use the device, or filler will be applied. What will change in my life? So nothing will change, but if I have the opportunity, I can enlarge it. I mean, that's a nice idea. My confidence will be better. I will be more confident. Even though having a bigger penis doesn't necessarily mean you'll be more confident, if a person feels that way, there's not much that can be done about it. It's an answer I love. One of the answers I dislike the most is to satisfy my partner better, or because my partner wants it. Now, friends, there's something like this. If you are married, and your spouse suggests such a request, for example, if she says to make it thicker, then it can be done. There is no problem with this because you are married and you will continue your life with him. But if someone you've been with for 3 months says it would be better if it were a bit thicker, then don't get involved in that. Because you might break up with them, you broke up, and then you got together with a more petite woman. How will her vagina be narrower or longer? Then this time it will be too much for her. It will hurt. So for that reason, if you're not married and you don't have a regular sex life with someone, then what your partners say is important, of course. It can hurt a bit too. Even if he is married, it is not a big problem. If they say yours is a bit small, oh no, we're in big trouble there. I don't think you should worry too much, especially if you're not married. But if you are married and your spouse wants it and you want it too, as I said, if there's a disproportion like 16:8, then a thickening can be done. You will be happy and your partner will be happy and you can continue with your life. There's a response that makes it look fuller. In medicine, this is referred to as the locker room syndrome. So if the penis is a bit below average, it looks a bit fuller in the underwear, it's barely noticeable. People get hung up on that too. There's nothing to say about that. Well, my friends, is big in the movies. It's really interesting how big things are in these movies. I mean, I don't understand why they're hung up on this. Of course, the guys in the movies are going to have big penises. They wouldn't cast someone with a 10-centimeter penis in a porn film. So it doesn't make sense then. Then you'll say something like this. Is a guy who's 150 meters tall playing basketball? He's not playing. What are you going to do? The guys are 2 meters tall. Am I going to say that I'm short? Am I short? Am I supposed to say that it doesn't make my height any taller? I mean, this is a film industry. In the end, beautiful women are acting, muscular men are acting, there are big penises, there are big vaginas, there are beautiful curves. So this is a movie, this is a show, so not everyone is like that. I mean, judging yourself based on what you see in movies doesn't make much sense. Honestly, the word big from my friends doesn't make much sense to me either. Yes, I'm also asking the question of which method you want, because does he have knowledge about this or not? So it's someone who already knows more or less what they're going to do, non-surgical. Please, teacher, I want surgery for lengthening. I want to thicken it. I just want to thicken it. They just say it like that. There's no question about this. And then he asks, which one do you recommend here? If he asks this with good intentions, I mean the environment there, he understands everything. Of course, we make an aesthetic suggestion based on what your suggestion says. But I mean, if it feels like just do whatever you want, then that's a bit problematic. So I'm saying whatever you want, we can do that, but some conditions are necessary. So if some conditions are met, I mean, a person hasn't measured their penis. I measured it here. The penis size is normal. He still thinks it's small. He thinks that this way he will satisfy women. He doesn't realize whether it's length or thickness that matters to me. He says he wants both at the same time. If he says something like, I'm leaving it up to you, then there's a question mark there. It can be difficult to talk about penis dysphoria and morphophobia here. You need to be careful here. So here is the result. You can also ask yourself the questions that I ask my patients, and that will give you some ideas in your mind. Then you can continue with a doctor you trust and who is suitable for you. Thank you